Assalamu alaikum, hello everyone, welcome back to the channel. So in today's video, I'm going to talk about 3 drug habits from my perspective as a pharmacist that women over 40 really need to evaluate. You know, before I start this video, I do want to read off a little bit of a disclaimer in that the items that I'm discussing are mainly over-the-counter or OTC medications with a few of these drugs that are their required prescriptions. But if you are personally struggling with dependency on a scheduled substance such as an opioid, or even you might have an issue with an illicit substance, I do urge you to reach out to a trusted individual, a medical provider, or a confidential resource or source or organization, and I'm going to list that in the description box below. So to start off with, a drug is a chemical substance that produces a biological effect on the body when administered to a living organism. Drugs can be used to treat, cure, prevent disease or prevent illness, diagnose disease or illness, or to promote well-being. They can be consumed by inhalation, injection, smoking, ingestion, absorption via a patch, if you've ever seen a patch on the skin, suppository, or a dissolution under the tongue, which is a buccal formulation. Now, the FDA considers herbal supplements as foods, not medicines. However, I want you to reconsider that statement, because herbal remedies or supplements, they do parallel drugs in the sense that they are used for well-being for the most part. No supplements have ever claimed to treat or cure, but there's some parallel when you think about drugs as defined by the FDA and herbal supplements. But let's dive in. So number 1, I want all of you women who are pill poppers to reevaluate this habit. And when I say pill poppers, these are people who generally or regularly take a lot of pills and a lot of quantity regularly. So you're taking medication every day. And if it's not prescribed medication with a direct and clear, an outcome that you're looking for, you might need to pause and think about why you're taking so many pills. So I'm not referencing multivitamins, I'm not referencing probiotics, which are typically taken on a daily basis, or, as I said before, those prescription medications that have been prescribed to you by a medical doctor for a specific reason. But some of you might be taking a lot of agents that are barbiturates and pain medication. So when I say barbiturates, I'm talking about items that help you sleep, relieve anxiety, or relieve muscle spasms. Or with pain medications, I'm talking about, for example, non-steroid anti-inflammatory drugs or ibuprofen, or fever-reducing, pain-relieving medications such as acetaminophen. Now, if you're not under the direct supervision of a medical doctor, nurse, pharmacist, or herbalist, you really need to think about why it is you need so many medications to help you sleep, to help you relieve anxiety, to help you with whatever pain ailments you're going through. And that, for me, signals there is something else going on with your body that needs reevaluation. What is the underlying issue that is causing you to not get enough sleep, or that is causing you to be in so much pain? Now, I know that for some of you, sleep is an issue. If you work shift work, might be difficult, or if you are eating too close to bedtime, or if you are getting too much blue light stimulation before going to bed. And these are things you can modify. These are modifiable things. Shift work, you just have to figure out how to balance. Easy for me to say to you when it's your life and you have to figure out that balance, the play on balance of how to manage your sleep and time better during the day if you are working shift work. Now, again, it's no surprise, as we're aging, as women over 40, our bodies are changing, and we may not be able to sleep as well as we used to. We may not be able to digest food as well as we used to, or even, one small turn and we're finding ourselves in a lot of pain. Like if we turn our neck too fast, or if we twist our body this way, it's like, oh boy, we're feeling a little different. We're feeling those aches and pains. But I do want you to understand that as time goes on, we do really need to be more aware of what we're going through and how we're feeling, and try to get to a state where we're addressing those concerns sooner rather than later. So don't wait until it's too late, until you're popping so many pills looking for relief. And it's, pills are passed through the liver. The liver, it's a bypass effect. The liver processes all of your oral medications first. So if you're overweighing or putting too much stress on the liver, that's another thing that you're going to want to think about. I'm not here to scare anybody, but I do want you to understand biologically, those medications you take have to be metabolized in some way, shape, or form. So please do yourself a favor and make sure you are addressing any underlying conditions or things that you might be going through so that you can get control of pill popping, okay? I have my handy notes here. So the second thing I'm going to say is I want all of you women who are consistently trying too many remedies all at the same time to please stop. Now, what do I mean by this? So let's say on week 1, you're trying a new, so let's give ourselves, there are many things we might have tried, multiple medications, acne, irregular bleeding, menstrual cramps, digestive issues. So on week 1, we're trying an over-the-counter agent. On week 2, we may not see as much relief, so we're going to Amazon to shop for another product. And then on week 3, we're going to iHerb to pick up a new product. Please, let's take a break and really try to address that one issue with one remedy first, because one of the things that we tend to do is if we're piling on too many things, too many drugs, too many remedies all at the same time, we're not going to know which one is really going to work for us. Sometimes it takes 2 to 4 weeks or more for a particular drug to have its effect, or for a particular product to work, in the way it was intended to. If the situation is too much for you to bear, then you will need to seek medical advice. But let me tell you, by piling on too many medications and not figuring out which one works best, you run the risk of causing more harm than good. And it's similar to pill popping. It's like you're taking too many medications, you're overwhelming the body with so many substances in these medications. You have a lot of chemicals in the medications, not only the active ingredient, but also a lot of inactive ingredients that are just there to hold that active medication together while it works in your body, So please do yourself a favor, and within a small window, don't overwhelm your body if you want to try a new medication. If you've done your due diligence and you've looked at the medication or the herbal product and you feel like it might be something that you might want to try, just give yourself time. And also, learn about the products, research, if you want to ask me, go ahead and ask me. I can try and put a video together, because I do use evidence-based sources to provide you with as much information as I can on my channel. And then the best thing I think you can actually do, if you haven't already done this and you're jumping from product to product, because I don't want you to jump from product to product if you're not seeing relief, is I want you to see a provider and at a minimum get a physical examination and get some baseline blood work done. There are a few hormones that we normally test on a year-to-year basis, and those include a thyroid hormone and an insulin hormone. And these are two main hormones that fluctuate for women as we age. And so I do want you to consider taking that first step if you're not seeing relief from some of the agents that you've already been taking. Because there are a lot of things that could be affecting us. We may not be able to see it visually, but internally we might have some things we need to work on. So I do want you to please consider that. Now, the third and final drug habit that I want all of you women who are relying solely on medication to make you better, to think beyond medication. Now, there are a lot of healthcare providers or non-healthcare providers that believe the pharmaceutical industry is evil and they're just out there to make money. And hey, that's personal opinion. I'm not here to dispel that or argue against that, not today anyways. But what I am going to do is I want to be a little bit more specific on this one, and I want to relate it to weight loss. I want to use weight loss as the example because I know some of you watching may have already taken a specific type of weight loss medication, and you may not understand that the medication is there to serve a purpose, but there's more work you need to do beyond just taking that medication. Hopefully there are programs set up for you to follow, including diet, nutrition programs, as well as exercise programs. These are supplemental, but they're necessary. They're not really supplemental. They're more necessary when you're taking these medications. And truthfully, this statement about not solely relying on the medication to fix you or to help you can be applied to heart disease, diabetes, cancer, a lot of ailments that we're facing as a community, as a women over 40, as a women, So let me reference Wegovy and Zepbound. So for simplicity's sake, these are GLP-1 injections that are approved for patients who are obese. Now, if you're a woman, I'm just going to use a woman as example because that's my main audience. If you're a woman who has a BMI, a body mass index over 30, or you have a BMI of 27 plus one weight or obesity-related illness, so I'm talking about diabetes, heart disease, then technically you're approved. You should be approved to take this medication should your insurance cover it. Most insurances are pushing back on covering those types of agents, even though Wegovy and Zepbound are approved for weight loss, not the diabetes medications. However, think about, again, like I said, in conjunction with that, you need to think about your lifestyle habits, the food you eat. Think about eating a Mediterranean diet, for example, or a diet that has low trans fat, low sugar, no alcohol, low or to no processed food, and that will get you farther than you could have ever imagined just being on the medication alone. There are a lot of side effects with these particular medications. I'm not going to talk about the side effects today, but I know that can also be challenging for some patients who, nausea and upset stomach, just a couple, who may not be able to handle those side effects from Zepbound and Wegovy, and so they don't stick with the medication. So that's what you always need to consider. You may not, you might think the medication will work wonders for you. You may see good results on the medication, or you may not even be able to handle the impact of what it's doing to your body. So again, honestly, you should have received all this information before you started taking the medication, and the fact that you might experience some you might experience some really negative side effects. Side effects are negative. Sorry, I'm trying to pick out the word that I want to say here, but when you consider things you need to add and do in addition to the medication, that is where I want you to go. I want you to think beyond the medication and think about how you're going to change your life so that when you do get to your preferred weight or to your ideal weight, you can stay there and you can be happy and you can be content, or you can recomp and do whatever you need to do, but you're going to do it and continue to do it very, very healthily, right? We're going to talk about eating well, exercising well, and all those good things. And I have a lot of those videos on my channel, so I do want you to go and check them out. Habit videos, exercise videos, recomp videos for women over 40 who are trying to, snap back. Maybe or maybe not you have kids, or maybe you just struggled with your weight for most of your adult life. So yeah, check out some of those. I'll link those below. So now, one of the things I do want to say, because that wraps up my 3 points, I don't want to make the assumption that you have or don't have access to care. But as a person who has, in one point in time in my life, had limited access to care, I do want to leave a few links for those of you who are at a situation where you have no or low cost health options. So I'm going to leave those in the description. I'm also going to speak to my international ladies who are watching this, because I am US based, so I can only speak about the health system in the US. Honestly, and in the US, it's not like it's cohesive or one size fits all across the states. It's different. But for my international ladies outside of the US, it's a big task, but I apologize. I don't have access to or the information to provide you. So if anybody's watching this who knows of any information about international access to healthcare, and international is international. So if you're from a particular country or continent and you want to leave a link for women who might happen to pass through this video, just leave it below. Maybe somebody might benefit from it. But that's a big task. That's a good business task, is getting healthcare around the world linked up for women, by women. But anyways, that wraps what I wanted to say today. And so again, I do encourage you ladies over 40, who are reaching 40, who are over 40, who are sailing into the 50s, 60s and above, to please also remember to take care of yourselves. Do what you can for others, but do what's best for you, right? I want you to remember that as you're making your way through this life. And I thank you for watching, and I shall see you in the next video. Take care. Bye.